constipation and IBS-C. Sometimes it is very difficult for a clinician to distinguish between IBS-C and CIC and determine the appropriate therapy. How to make the diagnosis? We know about this: history taking, red flags, physical examination, and investigation. Patient's history, Rome 4 criteria that we have already discussed: stool consistency, history of laxative use, secondary causes, alarm features. We all know about that: change in stool caliber, Hem positive stool, iron deficiency anemia, wet loss, rectal bleeding. These are the red flags in constipation. Pathology, physical examination and investigation. Physical examination, gastrointestinal mass and lymphadenopathy. DRE, we can find fecal infection, rectal mass, stricture, prolapse, rectocele. And the investigations that we commonly do is colonoscopy, sigmoidoscopy, anorectal manometry, balloon expansion test. Now we're coming to the management part, multi-phasic approach. Non-pharmacological approach, this is the first line treatment in any kind of constipation. Patient's education is very important. Hydration, mobilization, increasing dietary fiber, and toilet ensure privacy and hygiene. This is the first line treatment. Now we are heading towards medical management, laxatives, which we commonly prescribe. There are 4 types, mainly: bulk forming, osmotic, stimulant, and lubricants. Bulk forming laxatives, they increase the bulk or weight of the stool, which in turn stimulates our bowel. Examples include psyllium and isopulahas. Osmotic laxatives, they draw water from the rest of the body, polyethylene glycol. Stimulant laxatives, what do? They stimulate the gut muscles, helping the stool to pass. For example, bisagonal, sodium picosulfate. And lubricants, which are known as stool softeners, they work by reducing the surface tension between lipid and water interface. For example, WC. This is a pictorial representation of the bulk forming agents and their mechanism of action. What we need to consider while giving bulk forming agents is they can ferment in the intestine, which may cause gas and bloating. So take with fluids for bulk forming agents to work and to avoid fecal infection. Osmotic laxatives, what we need to consider is that increase fluid intake while taking osmotic laxatives to avoid dehydration. These lactulose can cause bloating, nausea, vomiting, and diarrhea. So we have to use it with caution on patients with pre-existing electrolyte imbalance, cardiac disease, and renal impairment. Stimulant laxatives, we have to consider that this can cause abdominal cramps, nausea, vomiting, or diarrhea. So Senna can cause melanosis coli. This is also we have to consider. So bisagonal has